So the British Social Attitudes Survey has been published, and amazingly enough, not everyone in Britain has the attitude, no, fine, nothing wrong here, move along. It's a huge, wide-ranging survey that looks at British people's attitudes to dozens of different things. And of all the possible takeouts from it, the BBC website has gone with this one. NHS, how unhappy is the public? A hugely negative piece with subheadings like reasons for unhappiness. They say things like there's been a significant downturn in public satisfaction with the NHS, which kind of misses the point, because people might be dissatisfied with the NHS, but I don't believe that people are actually unsatisfied with the idea of publicly funded healthcare. Like, there might have been a rise in air pollution and people might be cross about that, but it doesn't mean people want to get rid of the idea of air. They want it cleaned up, they want it done well. I'm dissatisfied with the health service. I've been told I've got to wait till June to have my wisdom teeth removed. But I'm not angry with doctors. I don't believe they're sat around twiddling their thumbs or, playing on their phones when they could be doing it. They're busy and they can't get it done because they're not properly funded and because they're understaffed and because they're rushing around. And when I do get my surgery, I don't even want the cheapest surgery, right? I want the best surgery. Nobody wants the cheapest treatment. Oh, here, we've got you some discount chemotherapy. Nobody wants that. We want the best for ourselves when it comes to healthcare, and that means funding it properly. But let's look anyway at the actual numbers on this British Social Attitudes Survey. They asked people whether or not they're satisfied with the NHS. They've been asking people this since 1983. This percentage satisfaction rate with the health service, it hit an all-time low in 1997, exactly the year that we saw the end of 18 years of continuous Conservative government. It was 34% at that point, and then it picked up and it reached an all-time high of 70%, right? More than twice the satisfaction rate in 2010 after 13 years of continuous Labour government, which just goes to show that even under a shit, centrist, Tony Blair-led Labour government, it's possible to fund the health service in a way that sees satisfaction levels like sweeping upwards. I mean, just imagine how we'd be under a real leftist, proper, full-on Labour government, and the answer for the record is well. Since then, it's fallen back from 70% to 63%, which is not really all that dramatic as a number for the BBC to pick up on. And to say, how unhappy is the public over a 63% satisfaction rate? I mean, that's still 11% more popular than Brexit. 52% of the population wanted, or 52% of those surveyed wanted Brexit, and bear in mind that 51.9% of them wanted Brexit because they had been lied to and told that Brexit would lead to more funding for the health service. Cue predictable picture of bus with bullshit on. The truth is, of course, we should never have had a referendum on Brexit because nobody understood the issues, and this was just all fake news. Fake news, bullshit. The truth is that we should have, if we're going to have a referendum, a much more sensible thing to have a referendum on would be whether or not people want their healthcare publicly funded and well funded. And the answer, of course, would be that, 99.9% of people in Britain want a healthcare system that works for everyone and that has an adequate level of funding to get staffing levels up, to get waiting lists down, to get people treated promptly, and then people could get back to work, and actually that would boost the economy, unlike Brexit. But of course, that's the one thing that Theresa May and her government are just never going to give us.